Now up next, we are looking at the clinical features of disseminated intravascular coagulation. So first of all, we looked at disseminated intravascular coagulation, and we said it's a disease condition where, first of all, it's not really a disease itself, it's something that is usually triggering it. So first of all, there's too much clot formation in the body. Now the body uses up all those fibrinogen, platelets and all, so the body has to now tilt into bleeding. You understand? So disseminated intravascular coagulation presents with dramatic, often paradoxical mixing of bleeding and clotting symptoms, So reflecting it under pathology, its underlying pathology of uncontrolled coagulation and fibrinolysis. So first of all, there's so much clot formation. Later on, the body uses up the resources to how to tilt into bleeding, and some of the clots are also still being broken down. You understand? So for bleeding manifestation, that's issues related to bleeding. So you can the person is just like that. All of a sudden you just see bleeding from different parts of the body. So from the gums, from the nose, from the GI tract, oozing from if they do any venipuncture, or if they try to give them any drug through the intravenous part, bleed so much, So petechiae, bleeding under the skin, we give these characteristics rashes, Then hematuria, hematemesis, or melena, Post-operative bleeding or bleeding from surgical drains, Then intracranial hemorrhage in severe cases. Then issues related to too much clot formation. So you can have digital ischemia. So the small blood vessels in your extremities, like the hand, the legs, the toes, they could easily get totally blocked. So those tissues around that place are not receiving enough oxygen, they are not receiving enough nutrients, so they could actually gangrene up. So deep vein thrombosis is also there, pulmonary embolism is also there, organ infarctions are also there. The levedo reticularis is a mottled skin pattern due to vascular occlusions. So organ specific dysfunctions. So you can have a lot of thrombus formation in different organs. So the kidneys could fail, the livers could get dysfunctioned, your respiratory system could actually get stressed up. You can have blockage of blood vessels in the brain and all of that. Then shock. So systemic clues, once you see somebody bleeding from more than 3 unrelated, like more than 3 sites, or you just see like 2 unrelated sites, maybe all of a sudden you just see blood, from the stomach, blood from the nose, they're totally unrelated. Can be suspecting sepsis. Then most of the times, if the person has the underlying causes, like you can be suspecting DIC rather. So the person has things like sepsis, traumas, malignancies. You can further on do more testings to confirm.